Hey guys, this is my presentation on irritable bowel syndrome. So, what is it? Irritable bowel syndrome is abdominal discomfort or pain associated with altered bowel movement. Usually, this takes place in the gastrointestinal tract, and there is no known prevention of irritable bowel syndrome. However, you can treat your symptoms, and there's also no cure. So signs and symptoms can kind of be tricky depending on each individual. They will vary. So sometimes individuals will predominantly have constipation, and other times individuals will predominantly have diarrhea. Now, there are individuals who fall in the middle of that, where they will kind of have an alternating of the symptoms, diarrhea and constipation, along with the stomach cramps and stomach bloating, usually found in all individuals with irritable bowel syndrome. And then there are individuals who suffer solely just upper abdominal pain and bloating. And as long as they have that generalized stomach discomfort, usually individuals will be diagnosed with irritable bowel syndrome. So when would it be present? There's no specific time of year. It's not like the flu season where it's going to have a flare-up depending on the season. That's usually not what happens. However, there is a peak prevalence in age, usually ranging from the ages of 20 to 39 years old. You have a higher likelihood of probably being diagnosed with it. And it's also found more commonly in women than men. Irritable bowel syndrome affects 5 to 10% of the population. So there are no diagnostic tests to diagnose IBS. However, doctors will diagnose you with IBS after 3 consecutive months of symptoms of inconsistent bowel movements, and also along with those generalized stomach pains. With a mixture of symptoms, usually by then a doctor will diagnose you with IBS. So for treatment and your long-term effects, there is no cure to IBS. However, there are steps you can take to kind of help prevent flare-ups and also just help treat it. So a few things that individuals do is usually have a high-fiber diet. That basically means just whole grains, fruits, vegetables, those types of diets, kind of avoiding anything in high preservatives. Also stress management, because if you have a higher workload or stress level, it can often cause flare-ups in IBS. And then as well as to treat these symptoms, you can take over-the-counter medications, so Pepto-Bismol, Miralax, depending on the symptoms you get, you can vary your medications. And then there are prescriptions if you have extreme stomach discomfort. These prescriptions are known as antispasmodics, which is just a fancy word for saying that it's going to treat your stomach cramps. And so return to play is also a tricky subject for patients with IBS. Now, you aren't going to be held back or not able to play because of your IBS. However, it is very important to treat your symptoms as they occur. So in high stress level competition or, season, the end of a season usually is where athletes will experience IBS flare-ups. And it's important just to basically have a plan for your stress, and also be well equipped and aware of what will cause these flare-ups. And these are my references.